Welcome back. Today we're demonstrating an exercise called belly breathing. This is a really important exercise to practice when we're looking to improve movement and find solutions to things like low back pain. So if you'll remember, the goal of these programs is to limit the impact that goes through our joints. And one of the first things that we have to look out for is movement patterns, or how we coordinate certain movements. And it turns out that breathing is the foundational movement pattern. It's something we perform over 20,000 times a day, and it can get altered or changed over the course of our life just based on lifestyle and other factors. So it's something we do want to bring attention to improve the movement and again create more stability and stiffness in our spine. So to perform, it's relatively easy. You're going to lay on your back, hand on your stomach, and hand on your chest. You're going to take a 4-second breath in through your nose, and then you're going to do a 4-second exhale out through the nose as well. And what we really want to pay attention to is what the name suggests, belly breathing. And it's why we have our hands placed on our belly and our chest, is what we want to see is our belly hand elevate and our chest stay relatively level. What can happen, and you see in some people just based on their lifestyle, is that they become chest breathers, and when they take a deep breath in, it's all through their chest. So what we're trying to do is correct that with this belly breathing. So to perform, it's going to be 4 seconds in, deep breath in through the nose, and 4 seconds out. One more time, paying attention to which hand is rising first. And out. So there you have it. That's the belly breathing exercise. Thanks again for watching. My name is Dr. Carl Baird. This is Solving Pain with Strength. If you have any questions, please leave a comment down below. I look forward to connecting with you. Thanks so much.